everyone, I'm Dr. Parinaaz Parhar, Clinical Head at Oasis Fertility, Secunderabad, and today we'll be talking about a donor egg cycle. Donor eggs treatment is something which a patient needs to resort to if she has no eggs of her own. That's one of the most common indications for using donor eggs. If you're less than 40, you might be forced to use donor eggs if you're suffering from premature ovarian insufficiency, where you have achieved menopause earlier than what would be normally seen. At times, we also have patients who have achieved menopause at the normal age, around their 45 years, but they are still keen on having a child. And in India, they are allowed to realize their parenthood dream until the age of 50 years in case of the female. Sometimes we have patients who have a good ovarian reserve, but still they would be forced to go for donor eggs because their egg quality is very poor, as has been proven in their previous IVF cycles. Sometimes where a patient has multiple IVF failures because of poor egg quality, they too might need to go for donor egg cycle. Now, how is a donor egg cycle done? In this, you usually have a donor who is someone who is between the age of about 23 to 35 years. She is someone who is screened and selected by an ART bank. Usually the criteria which are kept in mind before selecting a donor is that she should be free from any infectious diseases. Her blood group should match that of the recipients, and she should not have any family history of any heritable diseases. The donor is then stimulated in place of the recipient for say about 10 to 12 days. She undergoes the oocyte retrieval under anesthesia, and then the recipient's husband's sperms are then combined with the donor in the laboratory. Now, as per the current Indian law, we are allowed to stimulate a donor to allow the use of only about 7 eggs, and a donor is allowed to donate her eggs only once in her lifetime. So, about 7 eggs from the donor are combined with the recipient's husband. The embryos formed are then transferred in the recipient's uterus once her lining is considered good enough to enable implantation. So that would mean that usually the recipient would need some hormone replacement therapy medications, hormonal pills, to make her endometrial lining grow. And once this is about say more than 8 millimeters in thickness, the embryos which have been formed using the donor's eggs are transferred in the recipient's uterus. A pregnancy test is done after 14 days. Because in most of these cases, this is an HRT cycle, this is an artificial hormone replacement therapy cycle where a pregnancy has been achieved. The recipient will need to be on medications, on injections, on hormonal pills in order to support this pregnancy for the first 3 months of it. After that, once the placenta takes over, the placenta is able to provide enough hormones in order to maintain this pregnancy like a natural cycle. The success rate of an IVF cycle using a donor egg depends on the age of the donor, and because the age of the donor is less than 35, there is a very good chance of success. A variable which might affect the success is mainly the husband's semen parameters as well as the uterine lining and the uterine health. The donors are usually people who have had proven fertility in the past. So it's usually assured that we use someone who has a past good fertile history before using their eggs.